We're here with our front office manager. This is Fonda, but she's also been a patient of Dr. Poyer's. So we're here to do a little interview. Tell us about why you came to see Dr. Renee.
Well, I took a fall a few months after I started working here, and I hurt my shoulder pretty bad, and I had it x-rayed, and they didn't find anything. And so finally I went to my rheumatologist and asked him to give me a cortisone shot in it because it was hurting really bad. Still didn't help. And he told me, oh, you're just getting older and things like this happen, and, arthritis sets in. And so I suffered with it for months thinking, I'm just getting older. And then one day I started to get up from a chair, and I kind of put my weight on the arm of the chair as I was getting up, and it was excruciating. That's when I decided I've got to do something. It's worth a try. And I can do whatever I want to with this arm now. It's wonderful. I'm so excited.
That's great. Think about before you came to see Dr. Renee. Aside from the cortisone shot, what else had you tried for your pain?
A baby in it, not moving.
Yeah.
Getting my husband to help me, and just totally resigning myself to the fact that I just couldn't use my left arm.
Mm-hmm. Why did you feel as though you had to wait about 8 months for PT? Was there an obstacle or fear or uncertainty?
That's not what I thought PT was for. I don't know. I worked here, and I just guess I didn't have a good concept. I just thought, I hurt myself. It's got to heal on its own. I didn't really think there was anything that could be done.
Mm-hmm. Since you came to see us, what impact have we made to the quality of your life?
Totally changed it. I've went from feeling like I'm an old woman and I'm falling apart to thinking, I still got a few good years left in me that I can move around.
That's great to hear. Of all the things that you enjoyed about coming to see Dr. Renee, what was one thing that stood out to you?
Probably her making me feel so comfortable. I mean, I just, from the minute that she started working on me, I just felt totally at ease and comfortable.
What would you say to anyone watching this video who is currently skeptical about PT or undecided?
Don't wait. Don't wait another second. Get it taken care of now. You have no idea what it can do for you. Even mentally. I was getting depressed mentally because I couldn't move, and I just thought, that's it. That's the way getting old is. Well, it's not. It doesn't have to be.
As an employee and a patient, what advice would you give patients coming in for the first time?
Come in with an open mind, and don't come in negative thinking it's not going to help me, because I haven't seen anybody yet that it hasn't helped.
Now that you've experienced Focus PT from a front office and patient point of view, how would you describe it to your best friend or a family member?
Well, the way I describe our office a lot is there's a lot of PT places out there. My husband had been to some, and it's kind of like the difference between our office going to Walmart to get a pair of tennis shoes or going to Foot Locker to get a pair of tennis shoes.
Yeah.
And we're the Foot Locker.
That's a good way of describing it. Well, thank you so much for letting me interview like this. I think this can really help a lot of people.
Well, thank you, Maggie.